Hospice is difficult. So hospice represents a transition from a focus on treatment and the control of the cancer to a focus on just quality of life. That transition is driven most often because there is a lack of active therapy, there is a lack of treatment that it's perceived to make a difference in the life of the patient. I'm just thinking of a patient of mine that with whom I had a discussion about hospice recently. This was a patient that I had been taking care of for 10 years. This patient had received nearly every drug available for kidney cancer and some investigational drugs. In fact, he had received 12 lines of therapy, which is most unusual. And we got to a point where I had nothing else to offer. And that was a very difficult situation when you have a patient, this is a young patient, and it's just one example of the many patients that one encounters. And you feel like, if you wish you had more treatments to offer to the patient. In other instances, a patient may have not gone through these many lines of therapies, though I think that today, most patients deserve at least 3 lines of therapy, I would say. Combined checkpoint inhibitors, cabozantinib, and lenvatinib and everolimus are 3 lines of therapy that for patients who really want to fight the cancer, I believe should be considered. And there are also the combinations of immune checkpoint inhibitors and TKIs, such as pembrolizumab and axitinib, which might also be considered in appropriate context. But the transition to hospice is a transition that is driven because there is this perception of lack of effective therapy. Of course, there may be patients who at some point feel like they are too tired of fighting the cancer, or they are too ill because of other conditions that they have beside the cancer, and they want to shift the focus from trying to control the cancer to being comfortable. And that's that transition to hospice. And so I would say that there are a number of factors that influence the transition to hospice, but that it's a very difficult transition.